Hello, everyone, and welcome back to another episode of our podcast series where we explore autism spectrum disorder from different perspectives. If you're a parent, therapist, or any educator, or any other professional who works closely with children with autism, might have had many questions like what is the reason behind autism, or am I doing a right thing for my child? Is autism curable? Like so many questions you might have had, right? But today we are gonna address all these questions with much more clarity and compassion, grounded in science and the real understanding of medical and neurological perspective. And to guide us through this conversation, we have a beautiful guest today, very special guest, I must say, Dr. Sameeta M Prabhu from Rainbow Hospital. She is a pediatric neurologist who works closely with children with autism and their family every single day. Thank you so much, Doctor, for joining with us today. And I'm so happy, truly honored, and proud for this moment.
Thank you, Steffi. Thank you so much for that much excitement and so much happiness to have me here. Hopefully, in the next few minutes, I can clarify as much as doubts as possible in a good way.
Yes.
Yeah.
So let's get started.
Sure.
So let's start from the very beginning, the very basic, because understanding why can reduce a lot of confusions and fear, right?
Sure.
So many parents must have gone through a phase of questioning, oh, what is this happen, why this is happen,
Okay.
or is this because of my pregnancy period, or is this genetic? It's like so many questions, right? So from a medical and neurological perspective, what is the current understanding of the causes of autism spectrum disorder?
Sure. See, let me just start with by explaining what exactly autism is. See, autism is something called as a neurodevelopmental disorder.
Mhm.
Okay. So, in this condition, what happens is a child's brain develops not abnormally, but a little different from the other children. That's why they're called neurodivergent and not neurotypical.
Yes.
So, their brain development does not typically grow, it
Mhm.
grows a little different.
Yes.
So, we say there's a difference in the connections within the brain, connectivity within the brain.
Mhm.
Certain structures of the brain might be a little different
Yes.
from how it is supposed to be. Because of these things, the children have the issues. Now, why does this happen? Why does the child have a neurodevelopmental disorder? It is important to know that almost a very huge chunk of it, almost all children, it is genetic. That is, a child is born with it. Okay. There is nothing contributing to it, like how we usually talk about how vaccines contribute or screen time contributes or lack of proper parenting may contribute to it. Not at all. It is usually a huge chunk of it is because of genetics. So genetics, maybe the child will have underlying genes which contribute to the autism. They may have other conditions like some syndromes, like you must have heard of certain Down syndrome, etc.
Yes,
So some
yes.
children with syndromes also may have autistic features.
Okay.
Or also a small chunk of children who have brain injuries during birth or during any part of their life. If they have an injury, especially in the younger age, they may not have autism, but they may have autistic features. So as you can see, it is nothing to do with the environment or how a child is brought up or the TV. It is more of what it mostly is because of the child is born with it. It's a genetic condition.
Oh,
yes.
That's give us a lot of clarity. As I said earlier, this clarity gives us, much more, it can reduce actually the confusions and fear.
Absolutely.
Now, another concern or confusion people may have is like how autism is diagnosed. Is there any test for diagnosing autism?
Yeah. So to diagnose a child with autism, there are a couple of things that I need. One is from the parent.
Okay.
Or say from the caretaker, from a teacher, what the difficulties they're facing. Many times they come with issues such as the child is not having an eye-to-eye contact, or not interacting with other children, or not speaking. Speech delay is most common cause why a parent will approach us.
Yes.
So the child is not speaking as per age, no eye contact, no social communication. Child is not interacting with other children or their own siblings, or not going and calling their parents. The biggest thing is a mother feels sad that they're not calling me amma or mummy or whatever. So first thing would be to take a very detailed history from a parent, telling us what the challenges they're facing. Second thing would be clinical observation, where when the child enters, I look at the child and I see, okay, how is this child interacting with me? Is he looking at me when I call his name? Is he having eye contact with me? If I ask him to do certain things, so age appropriate, as per his age, say he's 2 years old, I'll ask him to do certain things what a 2-year-old would do. And if I notice that he seems to not really interacting with me or etc. That is the second way that I will make a diagnosis.
Okay.
And finally, the diagnosis to actually say a child has autism, and if it is mild or moderate or severe, we have a set of assessments that a child will go through. So it is done with the help of a team, of a developmental team, a
Okay.
child psychologist, etc., who will sit with the child. There will be certain questionnaires that we'll ask the parent, as well as the child will be given some age appropriate tasks and they'll be observed by the psychologist.
Yes.
And then based on that, they will be given certain scoring. And then based on the scoring, you'll be able to give them the diagnosis. The child has autism, whether it is mild, moderate, severe, based on this particular test.
Okay, so basically it's happening because of this clinical observation and the
Yes.
symptoms that parents
Yes.
telling, and finally the
Correct.
test.
Yes. So as you can see, there is nothing like, for instance, doing a blood test will prove a child has autism. It is, or some scan which will prove, nothing like that. It is all clinical observation, the parents' findings as well as the assessment.
So
Yeah.
there are some criteria to
Absolutely.
meet.
Yes. Yes. We have
Whether the
something
child-
called as the DSM-5 criteria. So that is the criteria that that has been told to us. That has been, it's a fixed criteria.
Yes.
So we will, as per that, we will be analyzing the child.
Okay,
Yeah.
got
Yeah.
it. So another concern. Now the child got this diagnosis,
Right.
right? The child is diagnosed with autism.
Yeah.
So now the another common concern that many, not many, most of the parents or family must have faced is their future,
Right.
right? So is there any cure for autism, or is the child outgrow the autism, or should we focus only the skill and the management skill and development?
Yeah.
How it is?
See, it's a very good question, and you're absolutely right. I would say most, if not 99, I mean, if not 100%, 99% of parents will ask us the question: will my child be normal? Will my child be like other children? Will they grow up to go to normal school? Do we need to consider other schools? Will he be able to do his or her function by himself or herself, etc.? These are very important questions. But I always tell the parents, let's take one day at a time. The thing about autism is that it is not curable because we do not identify it as a disease. Okay.
Yes.
So autism is just the way a child thinks. The child does not think like other kids or does not behave in society like others. So we are expected, as in society, to be a particular way, how we interact, how we say hi, bye, etc. This child may not interact like others. They may not function like the other kids. But what we say is, that's why we call it neurodivergent. We do not say the child is a disease or the child is mentally challenged. We say the child is neurodivergent because they think differently.
Yes.
And yes, a child who's neurodivergent will be neurodivergent throughout their life. Okay, so it is not something that we can say give a medication for or do an operation and just completely cure the child of it. But the challenges that a child faces, like for instance interacting, or the social skills, or being able to do things by themselves, like independently doing their own things like taking a bath, going to the toilet, etc., etc. So these things we can work on. We can help them to live and integrate within the society and function like any other child or any other individual. So to answer your question, yes, it is no, it is not something that you can cure. It is lifelong. A child will not outgrow it. However, the challenges that they face can be really worked upon, and we can help them to manage this.
So here comes the role of therapies, right?
Absolutely.
So as being a therapist, I have heard this question many times.
Right.
How do therapies help a child with
Yes,
autism?
yes,
So
yes.
could you, from a neurological perspective, could you please explain our parents like how do therapies actually help a child with autism?
Sure. See, so how I'll explain this is by explaining something called as neuroplasticity. So what is neuroplasticity? So from the time a baby is born till about 2 and even till about 5 years of age, there is a lot of connectivity happening within the brain. Okay. So it is within the brain, is almost like you can consider it like electricity. So a lot of signals and connectivity happening within the brain.
Okay.
And this is very integral. So a child is learning a lot during the first 5 years of his or her life. So anything they see, sounds, what they're looking at, the smells, etc., they're taking it in a very fast rate. So how does therapy help? Therapy is where we repeatedly expose a child. Different types of therapies are there, I'm sure you know, and I'm sure many of the people, parents who are watching know there is speech therapy, there is occupational therapy, physiotherapy, etc., or behavioral therapy. So all these things, our aim is to teach the child repeatedly so that this connectivity is being formed. So when you keep repeating certain things and teaching these skills to the children, these connections are being formed. So during the first 5 years, they start grabbing it. and they
Okay.
start learning and they start picking up things.
Oh.
And hence therapy is the only, so I have to emphasize now that all over the world the only proven what can you say, health management, okay, the
Oh.
only proven management of autism, not treatment, management of
Management.
autism
Yes.
is therapy or
Okay.
are therapies.
Hmm.
So very well good structured organized therapy which consists of occupational physiotherapy, speech therapy, behavioral therapy together along with a child psychologist, special educator,
Hmm.
etc., a team together working is the only proven way in which a child can, some of the things that the child challenges are facing can be
Hmm.
worked on.
Okay, so I got to know now many parents had the clarity now
Yes,
what is actually
right.
the role of a therapy plays
Yeah.
in a child life.
Yes. Yeah.
Doctor, you said about this neuroplasticity and all, right? So is there a right time to start this therapy, or I can reframe the question: is there any golden window for these therapies for the kids?
So that's also again very good question, because many a times what tends to happen is,
Mm-hmm.
especially boys. See, we have a lot of myths when it comes to boys, speech, etc. So they say he's a boy, so he will develop speech later,
Late,
right?
yes.
Secondly, we send them to school. Let's wait. Once they go to school, they will pick
Hmm.
up.
Yes.
Or number three would be, his father also spoke late,
Late.
so he will also
Also,
speak late.
yes.
So what tends to happen? We keep waiting. But the
Hmm.
important thing, yes, this golden window is there. That is the neuroplasticity, the
Hmm.
age of the neuroplasticity.
Hmm.
So, like I said, this is the time when the child is, absorbing. It's almost like a sponge where the child is absorbing a lot of information.
Hmm.
So this is the time we have to we have to literally force in how much ever
Hmm.
information that we can to a child. So
Yes.
if you ask me which is the best time to start therapy, I would say the day you get diagnosis, that very day you have to start therapy.
Hmm.
Don't wait.
Hmm.
The quicker you start, the earlier you start, the more we can manage these symptoms.
Yes.
Yeah.
So, as I said in my previous podcast, also, like you can take little time to accept the fact that your
True.
child is
True.
diagnosed with autism,
Yes.
but don't wait too long to start the
Yes.
therapies, because this early intervention
Correct.
is way more important that you
Absolutely. I
think.
couldn't agree more.
Yes.
Absolutely. Absolutely.
Now, along with the therapy, many parents must have heard this from the social media or whatever about this medication.
Mhm.
Is there any proper medicine for autism,
Okay.
or are you giving just medication for the comorbidity or co-occurring conditions?
Okay. So again, a good question. So there is no particular medication which
Mm-hmm.
cures autism.
Mm-hmm.
But having said that, children with autism, I'm sure many parents as well as you as a therapist would have experienced them having sleep issues,
Yes.
behavioral issues where a child may injure himself or herself, may
Mm.
injure others,
Yes. Yes.
biting, screaming, throwing too many tantrums. Number three, children with autism have a little more chances of having epilepsy or
Hmm.
seizures they may
Yes.
have.
Yes.
So these are the very common things that a child with autism may have.
Hmm.
So treatment would basically be concentrated on the comorbidities or the issues the
Yes.
child may have along with having autism, okay?
Okay.
Like sleep issues, epilepsy, etc. So if a child has all these issues, then we will be treating it with appropriate medications.
Medications.
But having said that, though not very well proven, there are certain supplements
Mm-hmm.
that do seem to have a role
Mm-hmm.
in improving certain, say for instance, repetitive behaviors or
Mm.
some kind of hyperactivity or
Mm-hmm.
improving focus. So there are some supplements that we may start, which are very harmless in terms of side effects. They can be
Okay.
taken for a very long time. So
Mm-hmm.
something like omega fatty acids, L-carnosine. There are some
Mm-hmm.
syrups that we do
Supplements.
supplement them
Mm.
with. But having said that, supplements are just for helping them.
Yes.
Therapies is the way to go. This is to help.
Yes.
And if they have other issues, then we accordingly start them on
Yeah.
medications.
We need to put in a quotation mark that there is no proper medicine that can cure directly
Yes.
autism.
Yeah.
Right?
Unfortunately, not yet, but hopefully in
Hopefully,
time. In
yes,
time.
because science are growing day
Yes,
by
scientists
day.
are
We
always
can
growing.
expect anything.
Absolutely. Yeah.
Okay, doctor. Now let's talk about something very deep, okay? Because these days the social media platforms, our internets are providing information, and sometimes it is confusion,
Yes. Absolutely.
confusion information as well. So these days we are hearing, or parents are hearing much more information about stem cell therapy or the medicine called leucovorin.
Right.
So what do you think about it? Is there any scientific approach or scientific evidence behind these thingies?
So, see, the thing is that, like you said, social media always, it has a lot of positives, but a lot of negatives too.
Negatives.
And yes, now as you can see, we say autism is the trend right now, because most of the people who come to us earlier, people used to be
Mhm.
like, what is this?
Mhm.
Now a parent comes and asks me, is this autism?
Yes.
And it is not from all social and socio-economic status. People are coming and saying about, I know autism, I've seen social media, because so yes, social media has helped in increasing awareness. It helps
Yes.
us a lot because people come forward sooner and treatment is started sooner.
Mhm.
However, yes, along with that, a lot of confusion on social media, a lot of misinformation,
Yes.
and parents get, they end up doing a lot of tests. So this misinformation starts from number one, the causes. A lot of time people say because you didn't talk to your child, or because you were watching TV a lot, etc., etc. A lot of misinformation because
Yes,
of that.
yes.
So that is the first thing. So a lot of times parents come to us saying, "Madam, it's my fault because I am the one who did not speak to him, or I showed him the TV for a long time." So
Yes, yes.
so because of that, guilt is one thing that comes.
Mm.
Next would be, what are the tests that the child has to do.
Mhm.
So a lot of time people tell them that do all these things, tests that are
Test.
expensive tests that are ordered unnecessarily. So some children may require it. So it is not like every child with autism requires this test. So based on the child, if we feel the child has some other associated conditions, deficiencies, etc., then we write the blood tests.
Yes.
Otherwise, unnecessarily doing a huge list of tests, not at all required. Then comes to the diagnosis. A lot of times, people are just telling them, you don't have autism, child doesn't have autism, it's just speech delay, just do speech therapy. So a lot of time is wasted. They just go on doing speech therapy, thinking the child only has speech issues. Yeah. So because of that, the core features, like I told you, occupational therapy, etc., is not, the child is not, does not receive therapy on
Yes.
time, and again, delay happens there. Then comes the treatment. So treatment is best. So right now, especially with a lot of, I told you, like, with the FDA, etc., saying a lot of things, on social media. So, these things, the most common ones here are stem cell therapy and leucovorin. So very important and very clear. I would say this is the most important thing which I want to state. None of them are proven, and they also have side effects. So we are basically experimenting on a child if we are going to just randomly give them leucovorin or do stem cell therapy. Stem cell therapy has even more side effects. And no, there is nothing proving a fact that if a child does stem cell therapy, that they will improve.
Yes.
Many a times, what tends to happen is many people do stem cell therapy. Along with that, they're doing their therapies. Child will show some improvement, and then they attribute it to stem cell therapy. But no, it is also therapy that is helping them.
Yes.
So very clear. In fact, the Indian government has clearly said that it is banned because it is unnecessary cost, unnecessary side effects that you're putting a child through. Okay. So stem cell therapy is a no. Okay. Leucovorin again. So leucovorin is given to children who have something called as cerebral folate deficiency. So it is a condition where a child has reduced folate, which is a vitamin which we require for brain functioning. So in these children, what happens is that they're not having enough folate in their brain. So they will have some autism-like features. So for them, we have to give leucovorin, because leucovorin is another form of this folate, which a child is not having in the brain. So this leucovorin helps. So in those children who have cerebral folate deficiency and autistic features, we give them leucovorin.
How do we get to know that this child doesn't have this folate?
Excellent question. So see, a cerebral folate deficiency child will not just have autistic features. There are multiple things. By looking at the child, they have a small head size, they have seizures, they have other many symptoms, not just autism. Autism will be just a small part of it. So they will have other symptoms, and then by looking at the child where they say that this child is having so and so features, along with that has autistic features, we might think, okay, this looks like cerebral folate deficiency. We do appropriate tests for that, okay, which are a little more invasive, where we have to take a CSF, which is the spinal fluid. So we have to take a spinal fluid, study it, find the report, confirm they have cerebral folate deficiency, then give them leucovorin. Okay,
it's not for everybody.
Not for everyone. Leucovorin has side effects. It can itself cause hyperactivity. It has gut issues, etc. So unless and until it's required, don't give leucovorin. Very clear there also.
Very clear.
Yes.
And I'm not sure whether is it because of more awareness or something, or are we doing more screening and tests? These days, we are hearing more often that this child is diagnosed with autism, or that child is diagnosed with autism, right? Is it actually the autism cases are increasing, or is it because of awareness are increasing?
Yeah. So I think you answered your question, with your
Okay.
So you're absolutely right. There is no actual rise in autism. Very, very clearly, number one is with social media itself. See, again, this is a positive in case of social media, bringing out a lot about autism. So a lot of parents come to us because of that awareness. So increased awareness is one of the major reasons that autism has increased. Numbers have increased. Number two, screening. Even clinicians, earlier it used to be like, okay, mentally challenged, or something like that, where there was never a definition. So right now, as a medical society, we have a lot of definitions, clear definition as what is autism, what is ADHD, what is learning disability. So different things, we have very clear, defined definitions. So by looking at the child, when they fit all these criteria, we're able to really diagnose them. So number one is screening. Number two is because of these definitions, which are clear definitions which we have. And so because of that, we are seeing the increase in autism. So it is nothing to do with the food that we're eating, the environment that there's nothing proven. It may be, I don't know, but right now there is nothing proven that because of this thing, a phone or the environment or the etc etc. Not at all.
Not at all.
Yeah.
And another concern parents may have, or parents might have noticed, that autism does not come alone, right? They will be having some other conditions, parents, or some other challenges parents may have noticed, right? So could you please explain and give us the clarity, what are the other co-occurring conditions of autism?
So I think we have covered this in the previous a couple of questions ago. So basically, one of the most common things they come with is sleep issues. Okay, many a times these kids have a lot of issues with sleep. They may fall asleep, but they wake up multiple times at night. Some of them take a long time to sleep. So we do have to, first of all, we always try to see the environment when the child is sleeping. So we try to tackle that. If the environment has changed and yet the child has difficulty in sleeping, we do give some supplements to help the child sleep. That is one of the common things. Number two is behavioral issues. So behavioral issues may be in the form of, number one, a lot of aggression. So a child might be aggressive or may injure other kids, family members, or injure themselves. They might bite and hit their head on the wall, etc. So because of this, we do have certain medications, they're called antipsychotics, etc., which will reduce these kind of behavior the child might have. Number three is child might have associated hyperactivity or ADHD. So along with autism, a child might have hyperactivity too. So we might especially focus on hyperactivity issues. So because of which, a lot of time, especially coming from a therapy team or a school, they may say the child is not having any focus. We are trying to teach them, we're trying to do the therapies, but the child is not focusing and learning. So to improve focus and to reduce hyperactivity, we have some medications that we may use. And like I said, children with autism may have, if not all, they have a little bit more chances of having seizures or epilepsy. So in those cases, we might give some seizure medications. And lastly, like I said, there are a group of children who have autism-like features and they have other issues. Like for instance, like I told you, they might have syndromes, etc. So for them specifically, if any medication is required, we give it. Yeah.
To our final question, doctor, what would you like to say to a parent who just received the diagnosis of autism?
So, like you said earlier, of course, telling a parent that a child has autism and will have a lot of challenges growing up is not very easy as a parent to hear that, especially younger parents. And, first time hearing it is like a huge blow on your face. So, I would say take your time, register it, but then as quick as possible, bounce back. Okay. Remember that the more time you waste, the less the child is going to learn. So we need to use his neuroplasticity and start with the treatment, which is therapies. So first thing I would say that take your time to register and then move on, bounce back and start. Number two is, I would tell any parent, not just a parent of a neurodivergent child, I would tell any parent that do not compare. Okay, don't look at other kids or your other elder child, younger child, other kids and say, oh, that child is speaking so much, child is interacting so much. Why is my child not doing it? Every child is different. So understand your child, learn your child's positives, the negatives, or rather not negatives, positives, and what the challenges are. Help them out in that. Don't look at the child and think, why can't they be like everybody else? Number three is don't blame yourself. Okay, is it me? Is it my genes? Or is it that what I did? We didn't talk to the child. We showed too much screen time, etc. So don't blame yourself, because like I said, autism is something the child is born with. It is not your fault. That's a very important thing which I tell, especially, I may be biased, but women, especially mothers, they get very guilty and they feel that it's my fault, and people tend to blame them also. So because of that, it becomes very difficult, and psychologically it affects the parent also. Number four is, I would say, there's something called as a caregiver's burnout, where a parent might be doing everything for the child, all the
Mm.
therapies doing, going and seeing all the doctors, but they themselves feel depressed, they feel sad.
Mm.
So always reach out to somebody, take care of your mental health also. Always
Yes.
important, before you put on the mask of the next person, put on your mask, you know how they
Yes.
always say in
Yes.
the
Yes.
airplanes. So I would always say, take care of yourself too.
First.
Don't ignore your health.
Mm.
And of course, don't get carried away but by what random people are saying. There might be your parents, even your own parents, your own grandparents may tell you a lot of things.
Lot of things.
Friends may tell you a lot of things, social media may tell. I would say, do go to the person that knows the best.
Yes.
Go to professionals who do this for a living, day in and
Yes.
day out. Ask them. And I'm sure we have a huge community of doctors and professionals like yourself, who are more than happy to sit here and explain to you what
Exactly.
you should do and what you shouldn't
Yes.
do. So I think I would, I would probably say that. That's what I would tell the
Yes.
people who come to me.
That
Yeah.
was actually, good hope of message, and I couldn't agree more.
Right.
Because um, y- as a parent, you have to believe in your child rather
Yes.
than going for others'
Right.
perspective and point of view, right? You
Yes.
believe in your child, look for your child's strength, and
Yes.
work accordingly,
Correct.
right?
Yes.
So thank you so much, doctor, for joining with us today and sharing such a valuable information that many parents can relate to and move forward with it. And to all the parents who are listening today, once again, I want to say you are not alone in this journey.
Absolutely.
Okay, so take a small step at a time. Believe in your child. Let's move together. Thank you so much, everyone, for
Thank you.
joining and tuning with us today. And we will see you in the next episode. Bye bye.